Knees are the most commonly injured joints among runners and athletes of all kinds. This is especially true of long-duration activities, contact sports, and those activities which require quick lateral movements. A number of biomechanical factors can contribute to the likelihood of experiencing a knee injury, with one of the most common being known as dynamic knee valgus. This is an inward buckling of the knee that happens unconsciously during movement. It's very common among runners, where it can increase the lateral pull on the kneecap, causing it to track improperly throughout the gait cycle. Over time, this can cause runner's knee, tendinitis, or damage to the cartilage underneath the kneecap. In team sports, where there's a lot of distraction and the athletes are often moving quickly and powerfully, dynamic knee valgus can cause sudden and severe injuries, often torn ligaments or meniscus. A well-known example of this is NBA basketball player Derrick Rose, who has had 4 major knee surgeries during his NBA career. Rose, who is a very explosive player with an incredible vertical jump, has had a career-long bad habit of landing on one leg. He would often land flat-footed with his heel striking the ground, the foot pronating, and the knee buckling inward, causing long-term wear and tear and sometimes traumatic injury. An example of an athlete who did a great job of keeping the knee in good alignment during high-impact situations is former NFL running back Barry Sanders. Sanders' position required him to constantly change direction quickly, employ explosive movements, and attempt to run, spin around, or jump over the defense. Despite this incredible demand on his knees, Sanders only suffered one knee injury in a decade-long career, and this injury was the result of being tackled by some of the strongest men on the planet. So what makes one person susceptible to dynamic knee valgus and not another? A primary factor is weak glute muscles, and in particular, the gluteus medius. This muscle resides on the side of the pelvis and helps to stabilize the pelvis and upper thigh during walking, running, standing, and jumping. When this muscle is weak, it allows the upper thigh to internally rotate and adduct. This causes the knee to buckle inward in the previously mentioned knee valgus position. Traditionally, this is addressed through glute medius exercises such as hip hitches and lateral leg raises. These are great exercises for strengthening the glute medius and are easy and quick to employ. However, they don't address the following 2 causes of knee valgus. The next cause, and probably the one I hear the most about, is overpronation of the foot, which basically means that the arch collapses, the foot becomes flat, and the ankle caves inward. Once this happens, the knee will again be forced into the knee valgus position. You can often tell if you are experiencing overpronation on a regular basis by checking the wear pattern on the soles of your shoes. Overpronation will cause excess wear on the inner portion of the tread of the shoe. This is often corrected with supinations to stretch the muscles on the outside of the lower leg and strengthen the muscles on the inner portion of the lower leg. Calf raises to strengthen the ankle and the foot connection, and towel crunches to strengthen the arch of the foot. All of these are great exercises, and together with the exercises of the hip, they can make a huge impact on valgus knees. However, even these together do not address the final factor we discussed today. Kinesthetic awareness is an awareness of where your body is in space. In my opinion, the lack of kinesthetic awareness is the number one reason injuries occur. If you are focused on something other than your body mechanics, and your current movement habits are poor, you will consistently put your body into poor biomechanical positions, causing wear and tear, and likely you will eventually do this in the wrong moment when high forces are traveling through the body and something will snap or break. The previous exercises, while they will address strength and balances, do not do as well when it comes to creating kinesthetic awareness, though they are a great first step. The runner's hang starts off as an isometric running stance. You simply get yourself into a running position on one foot, though perhaps slightly exaggerated, and use a hand to support yourself if needed. This isometric running stance is by itself a great way to increase stability and kinesthetic awareness, though you will need to be aware of the alignment of your lower body, making sure the foot and the knee are aligned and the arch of the foot is active and not flat. If you find you can balance without hand support, go ahead and let go. Otherwise, continue holding and build up to an unsupported stance at a later time. At this point, you will bring your awareness to the side of your hip, where your glute medius is located. You should feel the glute medius as it connects to your outer, upper thigh and to the rim of your pelvis. With only one foot being your base of support, the muscles of the legs and the hip should be actively working to hold a solid structure, while the rest of the body, in a sense, hangs off the supporting leg through the tension of the glute medius and the stability of the knee, ankle, and foot. The sense of hanging off of the glute medius is what allows you to really develop some kinesthetic sense and also some kinesthetic intelligence of the glute medius muscle as you learn how to properly utilize it and what it does in a real-world situation. If If you contract the glute medius muscle, the hip will begin to turn over as it draws closer to the head of the femur. It will look and feel much like a kick, and as a tangent, this is also a really great exercise for martial artists who utilize kicks. If you relax the muscle, the pelvis will drop and you will feel a stretch in the glute medius. Be careful at this point, as some people will feel a lot of pull on the outer knee as you do this. Drop into it slowly and only to a point that feels comfortable. And throughout these 3 versions of the runner's hang, you must continue to keep the knee from caving in and the arch of the foot from collapsing. This will give you a good kinesthetic awareness of the integration of the foot, knee, and hips while in an athletic stance, increasing the strength, stability, and integration of the lower body, and also giving the adductors a good stretch in the contracted position. There are also many useful variations of this stance. If you deepen the stance past about 45 degrees of hip flexion, you will get a really good stretch in the pelvic outlet and the deep external hip rotators. This can be great for those with piriformis syndrome or pelvic tilts. And if you stand up straight, with the opposite leg held in hip flexion and the knee bent, it's roughly a tall running position. You can get a great activation of the anterior fibers of the glute medius in this stance, which are less active in the more bent forward positions. And of course, continue developing the habits of sturdy, bulletproof knee biomechanics in more positions. Another side note, the glute medius muscle is a very involved component of lateral hip hike postures. Whichever side of the hip is higher will usually have a weak and elongated glute medius and a short and contracted psoas, while the other side of the hip will have a long and weak psoas and a tight, overly contracted glute medius. The runner's hang will make a great addition to any rehab efforts for this postural issue. If you have this issue, it will create a very noticeable difference in how you are able to initially perform the runner's hang from one side to the other. If you have ever had a torn ACL, MCL, meniscus, runner's knee, or pain on the inner side of your knee, there's a good chance that you have had or continue to experience dynamic knee valgus without knowing it. Again, it's certainly not the only reason for these issues, but it's by far one of the most common. If this seems like you, and you're not currently in an injury state right now, or you just want to ensure good athletic hip, knee, and ankle mechanics in the future, map out how your body feels doing the movement, and also if there are any stiff points in the movement or a lack of motor control and strength. After getting the hang of it, you can start doing these as isometric holds for 15 to 30 seconds at a time, and also as slow, controlled dynamic movements for sets of 10 to 15. When this all feels easy, well controlled, and safe, you can progress by adding some light weights. I did this to rehab my ACL and to improve kicking balance and power, and it worked very well in both cases. You can also take the same biomechanics you've used in the runner's hang and apply them to single leg squats and deadlifts. In fact, because of the widespread dysfunction I've seen in this aspect of knee, hip, and ankle control, I also use the runner's hang as a prerequisite to single leg squats and deadlifts. These exercises are great for developing athletic strength and injury resistance. And finally, you will want to take your newfound body mechanics, awareness, and strength and try to maintain it during dynamic athletic movements. Ideally, this would first be done outside of sporting events so that you can maintain good awareness and finish cementing the habits. The goal of all of this is to make proper biomechanics an instinctual habit, so that by the end you can focus on your sport or activities again without worrying that you will unconsciously fall into dynamic knee valgus. I feel I should also mention that knee valgus is not always a bad thing. It's a position your body is capable of, and in many circumstances it is not an issue whatsoever. However, it becomes an issue in circumstances where high forces or repetitive forces are applied to this position, as it is not biomechanically suited to high force situations. Well, that's it for today. If you enjoyed, be sure to like and subscribe, and hit the notification bell to be notified of future videos. Leave any questions, experiences, or further tips for the community down in the comments section. And until next time, keep moving, my friends.